Hello, and I want to welcome you actually all today to an actual discussion about COVID-19 and actual disability. I'm actually Tom Campbell, and I'm an associate professor in actual social theory at the University of Leeds. I'm going to be in conversation actually today with actually Miro Griffiths, who is a Leaving Fellow here, who is working on disability politics and particularly the resistant practices of disabled people. This conversation develops out of a module that we've been running at the University of Leeds on the kind of social and political and kind of regulatory elements of the COVID-19 pandemic, which Miro and myself have both contributed to. In the previous conversations we've had, they've been really enriched by all of your comments and questions. So please feel free to ask questions as the kind of conversation progresses, and we'll do our best to kind of answer them and incorporate them into this discussion. So Miro, if we want to get straight into this, in this awful pandemic, when we think about our lives afterwards, 1 in 10 disabled people think that their life will never return to normal. Whilst 1 in 20 non-disabled people think that their life will not return to normal. This suggests to me a kind of pessimism about the future that disabled people are facing. And I was wondering if you could comment on this stark issue here.
You're absolutely right, Tom. And what's interesting is it could highlight how disabled people are fearful and worried about what a post-pandemic society looked like with regard to supporting disabled people. But it also, I think, raised an interesting question about this idea of normal. And often when the discourse around the pandemic has been to talk about getting back to normal as quick as possible. But of course, within disabled people's lives, I would argue that normal has never been very useful or good for disabled people. When we think about the toxicity surrounding idealized forms of functioning, of behaving, of processing information, the conformity and regularity that comes with that. So this idea of what normal could be going forward is worrying. And I think this is an opportunity to challenge that. When we try to challenge that idea of what scholars refer to as ableism, and our colleagues in the studies of ableism think about that, that idea that impairment is inherently negative, and that there is a desired way for the body to be and to be seen and to function. So what I'd hope listeners and those who are engaging with this talk can do is to think, well, if normal is not desirable, what do we want a post-pandemic society to look like when we think about ideas of accessibility and of inclusion? And whilst we're doing this in the context of disability, this has much implications and much significance to those who see themselves as non-disabled and to non-disabled communities as well. I think we're in a really good place to reimagine something which is much more rooted in ideas of accessibility and inclusion.
Yeah, so in our conversation yesterday with Andrew Wallace, about community, and Andrew was saying, that we should be utopian at this point, and we should be looking for opportunities to rebuild society in a more socially just and exciting way, and to harness some of the kind of positive experimentation that has been forced on us by the kind of social conditions of the pandemic. So Miro, if we're thinking about disability in relation to the pandemic, you and I both do work in disability studies, and I have, I think it's fair to say, a kind of similar understanding of disability, where if we speak about it, we're informed by disability activism and this big idea of the disabled people's movement in the UK of the social model of disability. So I just thought it would be helpful for viewers who are not familiar with those concepts, if you could sort of explain how we're going to be thinking about disability in this talk.
Sure. So I think the first thing to consider is how the dominant narratives and discourses around disability often create an individualized account of disability. I'm thinking here, Michael Oliver's ideas of the individual model of disability. And what we have with this is a location of the problem of disability being within the individual, and therefore we think about the functionality, the impairment, the health conditions as being the reason why disabled people are marginalized, and that usually leads to then questions of cure, rehabilitation, or segregation, or even eugenic principles to eradicate disabled people. And what we've seen is a response to that by disabled activists and by disabled people's organizations, which produced an alternative argument to this. And I'm thinking here about the likes of Paul Hunt in the 1960s, and thinking about the Union of the Physically Impaired Against Segregation, who for the first time described the restrictions that disabled people experience being imposed upon disabled people by the way society is organized. And with this slide, we can, there's examples of that ranging from isolation and segregation to a lack of rights to issues around transportation, buildings, services, policies, and so on. So the importance of how we frame disability within our work and within much of what we'll be talking about going forward in this talk is how it's about the political, economic, cultural, social arrangements that impact and create these unnecessary barriers that disabled people then are subjected to. And going forward and thinking about the post-pandemic society, one way is to embrace that social model approach of thinking about why do disabled people resist, how do they resist, and what are they resisting for, and using the social model as a way to allow disabled people to articulate and describe those unnecessary barriers and injustices. And then perhaps we may want to complement that with ideas of a human rights approach to policy, which is what Dr. Angharad Beckett and Professor Anna Lawson have been developing, of bringing together a human rights and social model approach. Or I think you're muted, Tom.
Yeah, I am. I'll just mute myself there. Excellent, and I'm in actual full agreement in actually thinking about disability in those ways. And certainly when I was a student, encountering those ideas about disability were a real revelation to me that really changed how I thought about myself and other disabled people. Now, Miro, if we're thinking about disability in this pandemic society. So the society which we're living in at the moment, what does the current data suggest about disabled people's position within this pandemic society?
Well, it's pretty bleak. So if we bring up slide 4, we can start at a European level.
Yeah.
And this was a piece of work done by the Disability Rights Monitor Group, which is a collection of disabled people's organizations and organizations associated with focusing on disability from across the world. And the thousands of responses to their survey has highlighted a number of themes, which I thought I could highlight here. So the first issue, at an international level, is to think about how disabled people that have experienced a lack of prioritization when it comes to emergency measures. And this has often been seen within institutions and within segregated environments where disabled people have been abandoned or they've been refused access to local emergency healthcare. And the second theme is around issues of a breakdown in essential services in the community. So there is data showing how access to food, access to support services, the maintaining of existing personal assistance frameworks has collapsed, and due to strict enforcement measures of lockdowns and a dismissive or a not informed view by police or by security forces has often led to disabled people being abandoned or trapped within their homes because they have no access to local resources. And there's also an intersectional aspect to this as well. And when we think about the prevalence of the coronavirus pandemic upon disabled women and girls who have been subjected to examples of violence, and in the context of children, there's been situations of being denied access to online education. So it's important that when we think about disability in the context of the pandemic, we try to create a framework of intersectionality to think about the nuances of how people's experiences at the cross-cutting of their identities and backgrounds and experiences will create new experiences here. And finally, I was just going to say, finally, there's also this final issue here around disabled people being denied access to basic and emergency healthcare, which we'll talk about later on.
So here I'm like really struck by this kind of shall I point you're making about the heterogeneity of disabled people. So you're thinking about it intersectionally. So kind of disabled girls, disabled women. We would also think about this obviously in terms of age and like ethnicity. Economic ability. And I think this is really, really important to just continue to emphasize when we're talking about disability and underlying health conditions in the context of the pandemic. Like, I know that I'm in a particular position where I'm the director of kind of student education in one of the schools in our university, but I know more students who are shielding than older people. And I think often when we think about the kind of category of the kind of clinically extremely vulnerable, we are thinking about it in the basis of kind of like people who are older at the other end of the actual life course, and we're not always thinking about how kind of dramatic those shielding measures have been on the lives of people.
Absolutely, yeah, and I think you can see that as well. If we narrow down the data here, if we go to slide 5, you can see some of this being played out in people's concerns and experiences. So on the one hand, you've got the lockdown measures don't really affect the level of worry that disabled people have,
right?
And this creates interesting avenues of thought here. One is there's issues around disabled people's trust of the measures that are being implemented by local or regional or national agendas and institutions, but it also raises questions about how disabled people access support and how they are engaging with policy that is taking account of those material deprivations, as well as the discursive factors associated with the view of disabled people within policy and people's cultural attitudes towards disabled people and the value and worth that they have in society. And there's also this other point here about disabled people's access to medical care has really shifted during the pandemic in terms of over half disabled people not receiving treatment or having the treatment cancelled or not started. And this is going to exacerbate impairment effects of people, which then will have a consequence for accessing the labour market or retaining in the labour market, retaining in the education system, being part of their community. So it's thinking about the wider implications of some of these points that are being highlighted. And if I could just go on to slide 6 now and just give a little bit more of a detailed example of this, particularly in the context of people with learning disabilities. And there's been some fantastic activists and scholars, such as Simone Aspis, scholars such as Professor Chris Hatton, who have highlighted the detrimental impact of the measures to support people with learning disabilities and how this has played out. So, for example, the data from LADA, which is the reporting mechanism of deaths of people with learning disabilities in society, is suggesting that when you take into account underreporting, 369 deaths of people with learning disabilities per 100,000 in the population. So that's 3.6 times the rate in terms of deaths. And you can see as well, people who are receiving community-based social care, 53% of the deaths are attributed to COVID-19. So there's real concerns about how we're providing and embedding support for people, not just in terms of underlying health conditions, but those who are experiencing those low socioeconomic platforms, who are being placed in really precarious situations with regard to healthcare, with regard to support, with regard to sustainable living, and how this is then playing out when people are either contracting the virus or being placed in areas where there's a high chance that they will be exposed to the virus in various forms.
So Miro, this is actually like really, really stark, and it seems kind of like clear that the kind of inequalities that actually a lot of disabled people are often facing have been like brought into really sharp relief, by the nature of the way that the kind of pandemic has unfolded in the UK. But to ask you a kind of a question now, actually, like across the globe, are the challenges that disabled people are kind of facing in kind of different countries and regions, are they different, and are they related to kind of how the societies deal with disability politically?
Well, there is nuances within different parts of the globe, and what I've done here is I've provided a table of some examples of what is being reported in terms of disabled people's experiences. Now, if we look at the Romanian example, and this was a piece of research done by a good friend of mine, Nadia Haddad, who's an activist based in Belgium, and what Nadia was highlighting and her colleagues was how in Romania, which tends to have a large program of institutionalization, there are explicit examples of disabled people in these institutions who contract the virus and need urgent medical care, and local health centers were refusing to go in. Right. They were told to leave the disabled people where they are. Incidentally, it was interesting that this also happened in France as well. But it's interesting that when the workers in these institutions were contaminated with the virus, they were immediately responded to by access to healthcare, but the disabled people were seen as not as much as a significance. And in Belgium, you see the issue of examples whereby people have had a collapse in their personal assistance or their self-directed support, and there's been no alternative forms of administration to protect them. So what you have with the Romanian and the Belgian example is problems of responding to disabled people in a crisis. There's not that preparedness. There's not that clear response to address the issues. And when you look at examples such as in the United States, I just drew one example from one of the states here, from Tennessee. In 2016, they altered their standards of care to say, well, in times of crisis and emergency, when resources will be stretched, there will now be a list of specific impairment groups that will no longer be able to access emergency health care. Incidentally, my impairment was also on that list as well. So if I was in Tennessee, I would be excluded from accessing healthcare. This was later resolved, but again, it shows the rationing, the eugenicist principles that underpin the rationing of resources and the selective criteria for who deserves what types of support. And finally, if I just pick up the examples of Brazil and the UK, what I have here is, in Brazil, there's been some research done to show the level, and I think that's underestimate 10,000. I think it's much higher than that. But you see levels of people in overcrowded and unhygienic institutions with limited access to healthcare provision. And you also, in the UK, we recognize that in 2016, we had the United Nations inquiry into violations of disabled people's human rights, brought about by the emphasis placed on medical assessments, punitive sanctioning, and widespread conditionality within social security provision. And what I'm trying to highlight here is that there has been a legacy of punitive and conditional social security. There has been historical practices of segregating disabled people from their communities. And this will not only lead to precarious situations, but these will then be exacerbated when we face periods of humanitarian crisis. So it's not just about the problems in the here and now, it's also thinking about how disabled people have been subjected to violent and hostile policy that has eventually led to where we are and created a much worse situation than it could have been.
So, this is like really fantastic, and actually really informative, Miro. But I just want to actually encourage our audience again. If you have experiences that you want to share or kind of questions that you want to ask, one of the wonderful elements of this form is that Miro and I are able to actually respond to your kind of questions and comments as we're talking. And it can really actually enrich the kind of direction and kind of character of the actual discussion. So if you want to share anything that, or ask any questions, then please do. But Miro, if so this kind of like global actual take is obviously actually really, really important, and a comparative actual like analysis obviously is important in any social science actual like account of an issue or kind of a problem. But if we're going back now to kind of think about England or the UK, then we face a number of kind of stark challenges and like real problems that we need to begin to like actually respond to now. And I guess I'd be interested in kind of talking through with you if we can draw any conclusions actually from the way that kind of like national and local governments have been handling the kind of the treatment of disabled people in this pandemic.
Well, I think it's interesting if we start with the strategies by the state to support disabled people, and I would characterize this as being a reinforcement of self-sufficiency, individualism, personal responsibility seen within not only the guidance given to disabled people, but also the measures that have been taken by the state. So if you think about the guidance first, we have situations where disabled people are told, stay indoors, don't engage with people in close proximity, reduce your contact with people. And of course, when we think about disabled people, we're thinking about the notion of interdependency. So disabled people are a perfect example of the importance that should be placed on interdependency. I require support of others, as others require support of me. And none of that is reflected in the policy. So what you then have is situations where disabled people are not having sustainable support, not having sufficient support, but much of the rhetoric and much of the language used is do things for yourself on your own. And this has been shown, recently, if we go to slide 8, John Prings has highlighted how there's been a quiet confession by the government that more should have been done to support disabled people in this period of crisis. And even if we think about something like the Coronavirus Act, which my background is not in terms of legality or legal context, but the Coronavirus Act, I think, is really worrying and concerning from a socio-political point of view. I think it acts as a kind of idea of where we're going with health and social care under the current administration. But it also doesn't make sense economically, and it doesn't make sense in terms of responding to the crisis that disabled people are experiencing. Because you saw with the Coronavirus Act an easement, a relaxing of duties of local authorities and local governments supporting disabled people. So then you have a situation where disabled people were stuck in hospital. They weren't allowed to go out and leave hospitals because they couldn't have an assessment, but also all assessments were suspended. You had situations where disabled people couldn't have a review of their current levels of support. So they had no way of actually improving upon what they may have, which may not be a sufficient level pre-pandemic, but certainly isn't during the pandemic. So this idea of easement and relaxing of duties of government and of local institutions to respond to disabled people's needs is really worrying. And I think it's something that we'll see going forward as well. And I suppose that this raises a broader point here about the failure to highlight disabled people's needs during times of crisis and humanitarian emergencies. And we've seen literature, people like our colleague, Professor Mark Priestley, has talked about this. And there's a call here for trying to take a social model approach, what we referred to before, as well as, in my view, a human rights approach to policy, to think about how do we ensure that disabled people and disabled people's organizations are involved and have agency to comment and address how to respond to disabled people's needs during crisis and in periods of preparedness before we get to crisis in these kind of situations.
So Miro, if I was going to just kind of like pick out kind of two themes there from kind of what you've been actually talking about, it kind of seems to me that you've been saying that kind of national government policy has approached disability as an individualized issue, so that disabled people should effectively kind of take on the responsibility for ensuring that they do not receive that indeed everybody in society that they do not contract COVID-19 by retreating into a individualized or or kind of like actually shielded position, which is, I think we're arguing, is in counter to the sort of political understanding that disabled people and disability rights organisations have been campaigning for, like around the social model of disability that emphasises interdependence, like etc. The other point that I want to pick up is are you saying that the kind of policies have devalued the lives of disabled people in a way that sort of suggests some sort of actual latent, so underlying eugenicist idea about the lives of disabled people and their worth?
Absolutely, and I think the idea of individual responsibility, if it becomes an incredibly weak plan or an agenda to implement when you take into account the material deprivation and the barriers that disabled people experience. Now, if you're asking disabled people on the one hand to take responsibility, as the state does, but at the same time is enacting policy measures where there is a clear undertone of eugenicist ideals. And you can see that in slide 10 with the misuse of do not attempt resuscitation forms that were used in a blanket methodology of calling around care homes, calling around group homes of people with learning disabilities, and placing them on their records with no forms of advocacy or informed consent to understand the implications of this. So there's a problem here, isn't there, around how, on the one hand, disabled people are being told, do things for yourself on your own, take responsibility, as we all have to. But at the same time, there is a constant attempt to devalue, to question the worth of disabled people in contemporary society, and to judge their contributions as a way to determine whether they should or should not have access to support. So I think from eugenics to austerity, and now with what we've seen with the Coronavirus Act, we've got a real bleak picture in terms of disabled people being subjected to real precarious situations on the basis of health measures, on the basis of changes in social security, and the problems that come with trying to remain in the labour market. And you can also see this in terms of the vaccination list as well. Bring up slide 11. We can see a good way of trying to make an example of this. If we go to the other slide with the Twitter conversation. What you have here is Baroness Jane Campbell, who's an established disabled activist and also a member of the House of Lords, raising the concerns around how people are, the high-risk shielders, people with learning disabilities, and so on, are placed in a very low down the vaccination list. And there's then obviously arguments to suggest why this shouldn't be the case, raised by Chris Hatton and Neil Crowther, who are both established voices on disability policy. And what you have here then is a kind of recognition that some people are being told, stay indoors, self-sufficiency, be subjected to concerns around whether you're going to get access to healthcare in the times of emergency, and so on. And then at the same time, they're being told, well, when we find a plan to move away from the pandemic, to move beyond the pandemic, the priority of disabled people is fairly low down. Now that's being challenged, and it has changed now. We've seen a separation of clinically extremely vulnerable people moving up the list. But I'm still perplexed, and I think this links back to your conversation with Nick in the first talk, around why wouldn't you create a vaccination list based on the circumstances that people find themselves in terms of the sectors that they work in terms of the level of support that they need as part of the society, or the responsibilities they have to support others, where that close contact cannot be distanced. So really, there's a real, I'm really perplexed here why we wouldn't take an approach.
And kind of go back to that point earlier about the heterogeneity of disabled people. I know some young people who were leading really active social lives who then found themselves shielding, since March, who maybe left the house a handful of times. So it does feel to me that in the creation of those kind of lists, we're operating ideal types of like vulnerability and ideal types of like age and which aren't helpful. So Miro, this is obviously, you know, in like addressing these like problems that we're facing actually like around actual disability and the pandemic. This, as you say, has been very bleak, and you know, it's at this point as we move now onto opportunities that we see coming out of the pandemic, which we think there are. It would be really good to kind of hear actually from the audience what kind of things that they think we should be actually thinking about. But we do actually have a question here, which is from Lisa, which is actually, how have people with actual disabilities who have been living in institutions been affected by the lack of visitation during the pandemic, and has any research been done on this? So Miro, can I pass that to you?
Yeah, so the research is emerging, and I think it's broadly captured in the way that people within institutions and residential centres have been abandoned in terms of support, in terms of protection, and so on. But the first part of the question, in terms of how it's been affected by visitation, I think it's a really important point, because it highlights the importance of the social contact. And when we think about measures to address the pandemic, as I said before, it's been one of retraction. So disabled people are supposed to remove themselves from the dangerous situations and are supposed to isolate. So where there has been a need to maintain support, that's been lost. But it also highlights how many disabled people have continuously lived in isolated environments where they don't have regular contact with people, and the loneliness and implications that has for health and for participation within the community. So visitation is an issue that needs to be looked at, because the response has always been to just say, well, there's a risk associated with visitation, so remove it, rather than thinking about, well, how do we ensure that we can provide sufficient support and protection in the pandemic, but can also encourage and maintain the contact that people desperately need, whether that's due to impairment effects, whether that's due to aspects of neurodiversity, or whether it's due to the reality of all our lives, which is, for the majority of us, we want to have sustained contact with other human beings.
Yeah, it's like something which I'm sure that we both miss, even though there are other people in our households. You know, it's and as much as we love them, other people's contact is greatly missed. So Miro, we have another question here that really kind of begins to actually pick up this like theme of eugenicism that actually you were talking about. So it says that there is some interesting research about the language of underlying health conditions and how it already establishes disabled people as being already halfway to death. So it doesn't matter much if we die. So I think this is a really powerful question by kind of Vera here. You know, whether in the framing of these categories, we are already undervaluing the actual or actually devaluing the actual lives of disabled people.
Well, yeah, there's certainly this issue of devaluing, but it also, you know, leads into that question of, well, you know, because they have underlying health conditions, if they die from the virus, then that was a main factor of their death, rather than thinking about the social determinants, rather than thinking about aspects of the material and discursive factors that contribute towards the marginalization of people. If people are marginalized or they're living in precarious situations, they're more likely to be exposed to the virus or die from the virus because of the situations that they find themselves in. But that is never part of the analysis or critique. So you get this, you know, this justification given of, well, the person was going to die probably because they have these underlying health conditions, and this really this means that we dismiss the social factors, but we also don't engage or critique the social factors as part of understanding our response to the pandemic. And this is, I think, something that disability scholars and activists have been trying to highlight, because the media outlets have not engaged with the complexity and the nuance of marginalization of communities during the pandemic situation.
No. So actually, Miro, we've been dealing with this kind of stark reality, as I said, of the awful problems that we see for disabled people and the awful injustices. I should frame it correctly, that disabled people have been facing actually in this pandemic. But actually, you and I, we're not completely pessimistic actually about this. We think that there's been interesting actually experimentation, and there's been ingenuity actually by disabled people, allies, and organisations. So we think there are somewhat opportunities, that as we come out of this, we might be able to build a more inclusive society, rather than going back to normal. So I guess the kind of first thing I want to ask is has the pandemic illustrated ways in which kind of work, education, support, the kind of labour market, could be more flexible, and therefore more inclusive to disabled people in general?
I think so. I think if let's take the labour market as an example of this.
Yeah.
For years we had disabled people demanding, if we want to have an accessible a labour market which is going to retain disabled people in the labour market, then we need to think about flexible working. We need to think about alternative forms of engaging in labour, in terms of technology, but also places of work, working from home, the flexibility around that. And for years, disabled activists were told it's not possible, or there's no demand for this. But of course, as soon as we come into a pandemic and we saw a surge towards flexible working, changing the practices of how we engage in the labour market, we now see opportunities that can be used creatively to improve disabled people's access to the labour market. And now, again, we should say, there are disabled people who cannot work and who don't want to work because of the detriment that may have on their health and impairments, and that's completely justified. But I think this raises, interesting ways about the way we think about contribution, the way we value contribution to society. And going into a post-pandemic society, we want to think about improving access to the labour market, but improving our understanding and changing the ways that we value or devalue people's contribution to their community. I mean, again, in your previous talk with Andrew, you talked about the significance of mutual aid. And although there are often problems with that, there are equally as well examples where disabled people were setting up cooperatives, where they were setting up mutual aid systems to support local people, disabled and non-disabled. So there's now, examples of the way that we should embrace contributions and change the way that we devalue certain contributions because they don't fit with the typical or standard forms of the labour market. But we also see this in terms of education as well. And the blended learning approaches that we've had now of having a variance in the way that students engage with their learning, in terms of location, to the technologies, to the equipment, to the forms of learning that people have, whether it's through lectures face-to-face, whether it's through online short clips and reading materials and so on. And what I think is important here to kind of grasp as we move forward is recognizing that in our existence as human beings, we should be celebrating the variance of human existence and celebrating the idea that actually there is no desirable way to do a certain thing. What we want to have is more opportunities for people to engage that takes account of the variance in their access requirements, and not have a preferred system where we try to make people conform to certain ways. And I think this is something that we want to pick up on in terms of strategies. So, whether we're talking about the European disability strategy, whether we're talking about the disability strategy in the UK that's due out in March, we have examples where we want to think about new forms of access and retention within education and labour market, but also in terms of self-directed support. There is great, exciting pieces of work being done by Reclaiming Our Futures Alliance, which is a collection of disabled people's organizations, thinking about a new form of national independent living. I'm using independent living in the context of disabled activism, which meant having sufficient support to do the things you want to do with your life. There's also examples of Social Care's Futures, the group that are trying to reform and radically overhaul social care, to rethink what support means in a post-pandemic society. Because as I said at the beginning, I don't want to go back to normal. What I want to go towards is an idea of challenging those ableist notions of the ideal way of being self-sufficient, of living your life, of functioning, and recognizing and celebrating the human variance. And I think one example of this moving forward is thinking about how we improve disabled people's collaboration and co-production within national, regional, and local agendas. So, there's some really fascinating work being done in Manchester, where there is a Greater Manchester Disabled People's Panel coordinated by Rick Burgess, a highly regarded activist. And this is about ensuring that disabled people have a platform to collaborate and hold some power and account to address the concerns within existing policy, but also reimagine a preferable and possible future, one rooted in inclusion and accessibility.
So Miro, Vera has actually made another comment here, that she is actually very pessimistic about any long-term change happening, because there is such a strong narrative about go back to normal. Now, in the other conversations we've had this far, and there's been this real sense that we shouldn't waste the opportunities that are presented by the pandemic to radically adjust how we live together. Andrew was saying actually yesterday how he felt, that we must embrace the kind of temptation to be utopian and to kind of see the kind of things that have happened and in kind of a positive way, and to dream. And I think it's kind of clear to me that when we've shown the kind of power of the state and the power of the community, and in building a furlough scheme overnight, the kind of mass creation of kind of mutual aid, mutual aid networks, etc., that we can be, that it is at least possible that we could actually build a more inclusive society after this, in the same way that after World War II in the UK we built a welfare state. I'm wondering if you're optimistic as I am that it's possible, or you're pessimistic in the way that kind of Vera is on this issue.
Well, I mean, my general approach to life is pessimism, but I am optimistic about this because the evidence is there that there's going to be further crises. If we think about the displacement of human beings across society, climate change, if we think about, we can be, we can feel critical, and we can feel, disillusioned by the, right-wing agendas that are populating across the world. So we know that crises are coming. We know that emergencies are coming. So the question is, what can we do now? Now, that idea of utopian vision, I think, is important. But there's also, I think, a question of how do we as disabled people and as disability studies and disabled activists, how do we articulate an alternative vision of society, one that doesn't just work for disabled people, but can also be embraced by those who perceive themselves to be non-disabled in society? Because when we try to radically overhaul the way society is organized for disabled people, embracing interdependency, embracing ideas of variation in human existence, that doesn't just work for disabled people, it works for a lot of different communities. And so I think it's about orientating our activism and our research to offer alternative ways of which society could be organized. Now, it may be about having a utopian vision, but what I'm more interested in is constantly having the question of, well, what do we mean by these terms? So we create the conversation, we create the enthusiasm to discuss this and to explore the possibilities. We don't necessarily need to have a clear vision, but we do want to have a dialogue where we are constantly trying to push, challenge and resist in one way, but also offer something which more and more people can actually join and be embraced by.
Yeah, and I really want to underline that I agree with you actually entirely, that adjustments that kind of benefit disabled people are kind of likely to impact on everybody. But also, it's worth remembering that actually most people across their life course are going to acquire an impairment and become a disabled person. So actually, disability is a major impact of the human condition. That kind of most of us are going to be impacted on by some point. Miro, you said so many actually wonderful things, but we're kind of coming to the end of the session. So are there any actual final points that you would like to make?
I think just in the short term, I think this is an opportunity to rethink the social contract between disabled people and the state and those with influential positions in society. And the ways to do that would be, one, think about embedding intersectionality within our policy critiques. within social policy, and 2, moving all forms of disability support and assessment towards a human rights approach.
Excellent, Miro. And if I can say that I really want to thank actually you and all of our speakers for their wonderful engagement in this in these conversations, and the audiences for their wonderful questions and comments that have really enriched our discussion. We're in the process now of organizing some additional sessions for the coming year. I'm hoping that we can have one on kind of prepping for disasters, which I'm excited about. But Miro, this has been wonderful, and thank you. So everybody, I kind of hope I will see you all again in 2021. Okay, and goodbye.